So welcome to the first tutorial on GMDC surgery. GMDC surgery. So let's begin right away. All right. So you are called to see a 70-year-old man with a painful swelling of the leg, the right leg, to be specific, of the right leg, of 5 days duration. He also complained of fever, chills, rigors, and anorexia. On examination, the right leg was markedly swollen up to the knee, warm with pitting edema around the medial, this is supposed to be medial, the medial malleolus, the medial malleolus. So 70-year-old man, pain in the leg of 5 day duration, fever, chills, rigor. Now, what are these things telling you? Fever, chills, rigors, warmth. What does it tell you? Swelling. These are signs of what?
Inflammation.
Inflammation, exactly. These are signs of what? Inflammation. So what comes to your mind is that there is what? An inflammatory process taking place in this question or in this man. And this inflammatory process is taking place on the leg. So when you have this at the back of your mind, you start thinking, what are my differentials? What do I look at for when I see somebody having a swelling? What do I think about? That helps you in your thinking, and it helps you to answer it appropriately. All right. So what are the questions they are likely to ask us? The question is, what is the most likely working diagnosis? The most likely working diagnosis in this question would definitely be what we call what? Cellulitis of the right leg. Cellulitis of the right leg. And when we talk about cellulitis, it's just a bacterial skin infection. Skin infection, a serious bacterial skin infection. And when it affects you, like we normally said, you will see the cardinal signs of what? Inflammation. You will see the cardinal sign of inflammation. It mostly affects the leg. However, it can also affect the face, the arms, and other areas. It can affect all of these areas. So again, over here, we are looking at what? A cellulitis or a cellulitic problem. Good. So what else? 3 relevant differential diagnoses. Like I was saying before, when you have inflammatory process taking place in the leg, one of the things that come to your mind is what? Is cellulitis. What other things will come into your mind? What other things? And over here, you are thinking of what to call what? The DVT or the deep vein thrombosis. Deep vein thrombosis. We have to call it the pyomyositis. That is what? Inflammation involving the skeletal muscles. So that's what? Pyomyositis. And you can also think of what? Osteomyelitis, bone infection. So anytime we talk about inflammatory process that's happening on the leg areas, these 4 things, never forget them. Cellulitis, deep vein thrombosis, pyomyositis, osteomyelitis. These things, never, ever forget them. And depending on the question, the presenting complaints, and the mechanism of action, then you narrow your answer. You then narrow your answer. So for example, if somebody is doesn't do a lot of activities, or is living a sedentary lifestyle, or is, let me say, fat or heavy, not moving, what it means is that DVT could be a possible diagnosis, isn't it? DVT could be a possible diagnosis. So some of these things, you need to know them. But over here, it's what? It is cellulitis. And differentials, DVT, pyomyositis, osteomyelitis. All right. Then we have one discriminating investigative procedure here. Or what it means is that give us one procedure that you want to do. So now you are thinking of what? Of cellulitis, isn't it? You're thinking of cellulitis. You are thinking of DVT. You are thinking of all of these things. definitely you want to look at the what? The vessels to see if there's a block in the vessels or the arterial supply or the venous supply, if there's something blocking it. All right. And again, part of the differentials is what we call the ulcers. Venous ulcers. They are all there. They are all there. So over here, one most important investigation that you will do is what we call what? The Doppler ultrasound. Doppler ultrasound. So it checks the lumen of the vessels. It checks the lumen of the vessels. So Doppler ultrasound over here of the leg, isn't it? So Doppler ultrasound of the right leg. Of the right leg. All right. The name for treatment modalities. Treatment modalities. How are you going to treat this patient? Or which areas are you going to be looking at for? Which areas are you going to be looking at for? So again, you have somebody who is having what? An edema or a pitting edema. There is pain, chills, fever. How are you going to treat this person? So one, always elevate the limb or the affected limb, elevate it. So if the person is affected on the leg, put a pillow under the leg so it will be elevated. Why? Because you want to what? Reduce the swelling, isn't it? That's the reason why you are elevating the limb. So elevate the limb. Then of course, we said cellulitis is a bacterial what? Infection. So definitely you want to throw in your what? Your antibiotics. So you throw in what? So you take a broad spectrum antibiotics because you're not sure. So what it means is that if you really want to be sure of the organism, you have to do what? Your cultures, whether the urine cultures or the blood what cultures, you have to do them to help you with the exact organism and the exact drug to use. But for now, immediately you want to just give or throw in a broad spectrum antibiotic. Then of course, you want to also, in case there is some blisters or there is some ulcers, things like that on it, you want to dress it, right? You want to dress it. So we have what to call antiseptic dressing. Antiseptic what? Dressing. Antiseptic dressing, especially when there's what? Blisters or when there's a rupture of all these blisters around. Then of course, the person is in pain. So what will you do? You have to give what? An analgesic. You have to give an analgesic. You can give your PMO. Some people think that para is not a potent analgesic. Trust me, it works like magic. It works like magic. Okay, it works like magic. But of course, if the pain is so, your choice of analgesic would depend on the pain or the degree of pain. The degree of pain. Some are use morphine, some are use diclo, some are use PMO. It all depends on the level of what or the degree of pain the person is experiencing. Then it will inform you of your choice of analgesic. So basically, these are the things you have to what look out for. Again, normally these things are not an emergency thing. The thing has been there for a very long time. You see, 5 days, it's not an emergency. It's been there. Person not taking it serious. And now it has developed what? This condition. Okay. So don't go me saying you have to do A, B, C. Yes, you have to do them, but it's not an emergency case, isn't it? So that's why I didn't place emphasis on it. But for every emergency case, emphasis on the ABC is paramount. If you don't bring it, I mean, it will be a problem. Trust me. All right. So basically, these are the few things you have to understand. All right. So now we have done a whole topic on swellings, isn't it? On swellings or leg swelling. All right. So basically, this is something that I wanted to show you of what we are talking about. So the first picture here, over here, we're talking about the cellulitis. So you see over here. So in case you have not seen it before, or you're thinking that this is an imaginary thing, look at it. I'm sure you have seen it before. So you see there's redness, there's warmth, and all of those kind of things. And sometimes some clinicians will use a marker to mark or to demarcate it where the infection is to see if it will spread or not. So you can see over here, the second picture over here, you see it has spread. That means this thing, and you see there are now blisters even forming. So abscess is there. So you don't have to take it for granted. You have to treat it. You have to treat it. All right. Then talking about the deep vein thrombosis. So normally this is a normal blood flow. So don't forget vessels have valves. Okay, so these are the valves. So blood is flowing nicely, beautifully. Okay. But when there's thrombosis, in other words, when there's a clot inside, so all these are all clot. This is a clot. I believe you can see what I'm marking. This is a clot. So a clot start coming in there, the lumen starts reducing. So Doppler ultrasound will actually tell you whether the lumen is closing or not. Okay. And if you don't take care, one of the things that actually kill our patient when they have deep vein thrombosis is this embolus. And it will go and affect the lungs, or to attack the lungs. And hence we call it what? Pulmonary thromboembolism, isn't it? Pulmonary thromboembolism. And it will kill you very fast. And those people who will get amputation, or we amputate their legs, their limbs, for instance, and they are old. You know, if you are old, moving is difficult for you already, and now your leg is cut off. They easily die because of this condition called what? Deep vein thrombosis or pulmonary thromboembolism. That's what they normally die of. So take note of that. Then we have this one here, the last picture here. So this is pyomyositis. So when there is a pus inside the muscles or infection inside the muscles, we call it what? Pyomyositis. Pyomyositis. So these are the various things when it comes to what? Swelling in the lower limb that you must be able to keep it at the back of your mind. Unfortunately, I didn't add osteomyelitis over here, but I mean, you can just Google it out and you can just find pictures to help you with what I'm talking about. All right.